All right, we are on. Welcome, everybody. Thank you for joining us for this week's episode of Weekly Dose with Dr. Uday. We have a treat for you. I have Dr. Victoria here. We're going to be talking all about menopause and sensuality. So, this is going to really good. So before I get started into all the goodness that we have for you, I'm going to start with introductions. So my name is Dr. Uday. For those that don't know me, I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. My goal is to have my patients not only feeling good, but looking good. So welcome, everyone. So I have Dr. Victoria Sorlie Aguilar here with us today. I'm going to give you some information about Dr. Victoria. She's a board certified family medicine physician near Los Angeles. She has been in practice for over 16 years and is deeply passionate about menopause and women's sensual health. She strongly believes that the choices we make as women for our health today will impact our future wellness and quality of life. So, Dr. Victoria, thank you so much for being here.
Thank you so much for having me, Dr. Uday. And I love that you want your patients to feel better and look better. We all deserve that. I deserve it. You deserve it. And as a fellow FP, I know that we get so much joy and gratification out of helping our patients live their best lives because we got this one body. It's got to last us a good, 100 years.
Absolutely.
So we can take care of it and we can nurture it and we can enjoy it as well.
Yes, I love it. So menopause and sensuality. So we're going to be doing some definitions to start. So how would you define menopause and perimenopause? All of that.
Yeah, so menopause is when a woman has not had a period for a year. The average age in the US is about age 51, but it can range anywhere 5 years earlier to 5 years later and still be considered in the normal range. So anywhere from like 45 to 55, most women will go into menopause. Women can even go into menopause earlier, but those are the average, 45 to 55. So when a woman's in that range, 45 to 55, and she hasn't had a cycle for a year, that's considered menopause. So you don't usually know you're in it until it already happened because you might be thinking, hey, this is my last cycle. Oh, here comes another one. Not yet. Here, oh, it has been 5 months. One more popped in there. So you don't really know it's happened until it already happened. Perimenopause is the 3 to 5 years before your last cycle where you're still having cycles, but they might be irregular. You might skip a few in between. You might have heavier cycles, and you might start to even have those symptoms that we typically associate with menopause. Perimenopause, you're still having cycles, but they're changing, and you're having classical menopause symptoms.
Gotcha. So how does menopause affect the body? What are those bodily changes that happen?
Good question. And I guess another way to frame that is, how does menopause not affect the body? Because it affects the whole body. Menopause happens because our follicles in our ovaries, we have a set amount, and our ovaries produce estrogen. And as we reach that 50-year, mark, we start to have a precipitous decline in estrogen until it just goes so far low that our body no longer feels the impact of estradiol, which is the most common type of estradiol produced in our ovaries. So we have estrogen receptors all over our body, from our brains to our eyes, to our skin, to our hearts, and obviously to everything below the belt, our vulva, which is the outside of our vagina, our labia, our clitoris, our urethra, where we urinate from, the inside of our vagina, where it's just the birth canal and where we have penetrative sex. So we have estrogen receptors from head to toe. So it can impact our body from head to toe. And a lot of those menopause symptoms are things that a lot of women probably heard of, hot flashes, night sweats, insomnia, vaginal dryness, pain with urination, frequent urination. Some women may be familiar with those. There's a lot of things women aren't familiar with, and those can be also depression, anxiety, insomnia, fatigue, low mood,
Absolutely.
brain fog, palpitations, so many symptoms, head to toe. Our bodies as women are impacted by living in a low estrogen state.
Okay, so then we take it a step further. How does all of this then affect sensuality?
It definitely is going to impact our sensual and sexual lives, actually. So, not just mechanically, although that is really important. So, if we think about our anatomy, our pleasure center in our vulva, which is, a lot of women don't know the name for the outer parts of the visible parts of their genital anatomies, the vulva, the labia majora, the labia majora, the labia minora, the clitoral hood, the clitoris, the urethra, and the opening. That's our vulva. And this is our, clitoris, and this area is our pleasure center, not only just, the internal vaginal canal. And what happens with menopause, since there's less estrogen, is we get less lubrication, less circulation, less sensation. So if we don't have estrogen support to our vulva, all those can impact our sensual lives. And so that's the kind of mechanical anatomy part of it. Aside from that, since depression and anxiety and fatigue and insomnia are also really frequent with menopause, up to 30% of women will have depression symptoms during menopause. And over 50% of women will suffer anxiety symptoms with menopause. And up to 80% of women will have hot flashes and night sweats, which can also cause insomnia. So if you put that together, not sleeping well, mood changes, and then dryness and less sensation, huge potential for impact on our sensual health with menopause. Yeah.
That's definitely impactful. So, what tips would you give towards maintaining a healthy sensual life?
So the bad news is that menopause can impact our whole entire body, including our sensual health. The good news is we don't have to take it lying down. We don't have to take it for something that we just have to, suck it up. We don't have to. There's so much that we can do. So what I would say is the number one thing is checking in with our vulvar and vaginal health, talking to our family doctor like Dr. Uday or Dr. Victoria, or our gynecologist, talking to our doctor about our vulvar health. If we're a lot of women, up to 80% suffer from genital urinary syndrome of menopause, and they don't tell their doctors. So they can't get help because they're embarrassed. They don't know the names for what they're feeling. It's very common. We expect you to have that. That's so common that we're almost certain you're going to have symptoms. We are not surprised or embarrassed if you talk to us about it. Talk to us about your vulvar health. Tell us if you're having dryness and burning and pain with sex, because we can help you. We can prescribe, well, first over the counter things women can do at home, plenty of lubrication with intimacy, either oil-based or water-based lubrications. They can be gotten without a prescription. They're over the counter. There's vaginal moisturizers that can also be gotten over the counter, and that can help sort of with friction and mechanical dryness. Above and beyond that, you and I, as family doctors, can prescribe vaginal estrogen for women who are menopausal, suffering from dryness. Low dose vaginal estrogen is very, very safe, and 90% of women can use it. It does not absorb into our systemic system, so it doesn't come with the classical risks of hormone therapy, which is a whole other topic. But just out the gate, vaginal estrogen can resolve and relieve us of those vaginal dryness symptoms. And not only does it help increase our lubrication, but low dose vaginal estrogen also improves circulation, blood flow, improves nerve sensation, so we can enjoy our intimate lives better. On top of that, another thing that we don't often talk about is urinary incontinence, sneezing and peeing. Whoa,
Yeah.
and you might have heard about it, or you might be feeling it, but you might also be embarrassed to talk to your doctor. But Kegels, a lot of people have heard of Kegels, muscle exercises to build up the pelvic floor. But vaginal estrogen also helps with, again, circulation to the vulvar area, to the pelvic floor muscles, and can help us in that aspect as well. So those are right out the gate. Taking care of the vulva, vagina, and bladder area, I would say is, step one. We need to make sure our anatomy is taken care of.
Absolutely. Those are amazing, actionable steps. So, guys, you have it. There you have it. So, just because you are going through menopause or you've been through menopause doesn't mean that, if you're having any of these changes or changes that are affecting sexuality, that there's nothing that can be done. So, so, Dr. Victoria, so I'm actually going to switch gears. The other question I asked, and this is completely separate from this, it's more about you. So, I usually ask, why do you do what you do, Doc? So, if you could answer that question, why do you do what you do?
Absolutely. I have to admit, I'm ashamed to admit that before I went through menopause, it wasn't really on my radar. I've been practicing medicine, like you said, for 16 years. And when I went to med school, I graduated in 2003. Um, I don't even recall having a talk on menopause. I really don't. And if we talked about it, I'm pretty sure what they said is don't prescribe hormones. They're super dangerous. Menopause happens. It happens for a year, and it's a natural phase of life. And I sort of didn't. It wasn't on my radar. And even in family medicine training, I went to an excellent residency program with excellent training in women's health and internal medicine. But again, it wasn't anything that was focused on, particularly in my training. So why I care so much about this is because when I went through menopause, which was around the transition time 43 to age 44, which by definition is early,
Right.
early menopause, I didn't know really what was happening to me. I didn't know about perimenopause. I didn't know that you could start to have menopause symptoms even though you still were having irregular cycles. I actually thought I was just kind of chubby and having irregular periods because I was stressed out and maybe a couple pounds overweight. So I really suffered needlessly because it wasn't on my radar. And I thought, geez, I'm a doctor
Right.
and a woman, and I'm not new at this, and I wasn't prepared. And if I'm not prepared, man, a lot of women out there are going to suffer needlessly. And I decided at that time that it wasn't enough for me to figure out how to take care of me so that I could live my best life. I wanted to, and I did really deep dive into it, Dr. Uday. I read books, I watched podcasts, I read research papers. I really went above and beyond because when I really first started feeling that way, I didn't know what to do. It wasn't like I could just go to my doctor and get an answer. The sad thing is, I don't know about you. I know you care about this topic because here I am. But in a
Right.
busy primary practice, a lot of doctors don't have the time or don't take the time to inform themselves about menopause treatment and care. So I realized I had a lot of work to do to inform myself, to educate my patients and my friends and my family and my colleagues. And what a joy it is to take something that was me suffering and going through it earlier and pivot that and turn it into something kind of like a mission. It's my passion to share this information.
Okay. So, all right. So, let's continue. The other question I have for you is, and this is completely separate, is what would you tell your 20-year-old self? With all the experiences that you've had, what would you tell your 20-year-old self?
That is a really good question. I think that, well, since we're talking about menopause and sensuality, such an important part of our sensual lives is our body confidence and body awareness. And a lot of us women spend way too much time talking negatively about ourselves to ourselves. We tend to have an internal negative self-talk like, oh, I'm so chubby, or God, why don't I exercise? I'm so lazy. Oh, my hair, it's horrible. And we do it so often and so much that
Mhm.
we don't even notice that we're doing it. We're kind of really mean to ourselves. And we say things to ourselves we would never tell our friends or family. And once we start developing an awareness for that, we catch ourselves and we realize how often we do it. So if I could talk to my 20-year-old self, I would love to go back and train her early to
Mm.
love herself, to love her body, to love her precious, tender heart and her human frailty, and understand that we're going to make mistakes. It's a journey of learning and loving and forgiveness to others, but mostly to ourselves. Because if we love ourselves and treat ourselves well, it's better for our physical health, it's better for our relationships, it's better for our sensual lives, it's better all along.
Absolutely. That is beautiful. That's actually why I asked the question, because there's always some extra nugget that could help somebody else out there in the same position. Oh, thank you so much, Dr. Victoria. This is amazing.
Absolutely.
So, where can people connect with you if they want to look you up, all of that?
Thank you. So my website is www.feminineflamemd.com. I have some free downloadable video guides on vaginal dryness and hot flashes and how menopause affects our body that go into more detail, kind of what we scratched the surface on. I'm having a menopause mastery course open up next month, which will be several modules of in-depth hormone instruction and menopause guidance. And you could follow me on Instagram at feminineflamemd.com. I'm so happy to be here and so grateful that you invited me, and just love talking about how we can flourish and thrive and be juicy and joyful as women in midlife.
I love it. Juicy and joyful. That is amazing. Thank
Thank you.
guys. Isn't this amazing? So you guys definitely check out Dr. Victoria. I'll include the information as well, and this is also going to go on podcast as well. So,
Thank
and
you.
those of you looking for primary care, quality primary care physician, we're accepting new patients at Apple Valley Family Medicine. Our number is 304-350-1087. And you can also find us online at www.applevalleyfamilymed.com. Thank you for tuning in. Thank you.